Okay, so I have Dr. Dolores Fernandez today, and we met, I think, just over the winter season, if I remember correctly. One of my local colleagues, Brittany Shammerhorn, also a naturopath, said, "Mel, you've got to meet this woman. She's doing cool things over on the other side of Canada, and I think you guys should connect." And so you and I had some nice conversations, and I've really got a new love for the products that you guys make at Iris, because we as physios see a lot of people that have questions around estrogen and moisturizers and lubricants. And I'll be honest, I feel like initially in practice, I was a bit nervous to give recommendations because I just didn't know enough about it. And as I learn more, there's a lot that we can share and around kind of how to guide people. We can't make the decisions for them. And obviously, we don't prescribe any hormones as physios, but just they like our recommendations as far as products go. And so I thought you would be a great help in helping people understand, for example, the differences between lubricants, moisturizers, estrogen, because, these are hot topics right now. And so before we get going on all this, will you take some time and just let everybody know a little bit about yourself?
Yeah, absolutely. I was so excited to be connected to you. Actually, I kind of been watching you for a bit because you're up to such cool things. And then Britt was like, "Hey, I got to introduce you to Melissa." So I'm so glad that
Mm.
she introduced us. So my name is Dr. Dolores Fernandez, and I am a naturopathic doctor here in Ontario. I have a clinical focus in menopause, or at least I did. And I'm also a Menopause Society Certified Practitioner. I have a little bit of pelvic floor training. I took level one, but more than anything, just to get familiar with what an assessment is when my patients would go see a pelvic floor physio. Not that I do any pelvic floor physiotherapy. And so over time, my clinical practice has kind of shifted to be very pelvic focused. I still see a good amount of menopause, but also some of those like vulvovaginal pelvic health conditions walk into my office too. But I'm also the founder and formulator of a product based line called Iris. And we make two products that I'm sure we're going to talk a bunch about
Mhm.
today.
Yes. I want to know, like, actually, that segues nicely to how did this come about? Because, how do you move from clinical practice to like, I got to make this product?
Yeah, no, it's a good question because I would have never guessed that this is where I was going to end up when I was in school. So I always joke and say, menopause found me. I left school thinking that I was going to be very fertility focused, and nobody walked into my office wanting fertility help, or like even though that's what I was advertising. It was all menopause, and so to make a long story short, I started just getting really into it in the menopause world. I got my North American Menopause Society certification. I started shadowing medical doctors. Anybody who would give me the time to learn about menopause, I was there. And then the pandemic hit, and I got very, very busy virtual practice all over Ontario. It was busy, and what I learned was that there is a whole science behind lubricants and vaginal moisturizers, and that they are not all made the same, even if they are marketed the same or have a similar price point. They're not all the same, and that there was ideal products for my patients. And so I started recommending products. And in Canada, I was having a hard time finding things that my patients can just get at the health food store or the drugstore. The products didn't exist in Canada unless they were shipping. And, at the time of COVID, my patients were like, I share an Amazon account with my kids. I don't really want to get
Mhm.
these things shipped to the house like that. And so I reached out to a local compounding pharmacy, and I just started compounding a vaginal moisturizer for my patients, and that was working great. And I was recommending a lubricant from Australia, and I was compounding this moisturizer. And honestly, after about 60 prescriptions written, I was like, there has to be a better way to do this. There has to be a way that I can make this accessible for people who can't see me as a patient, who are trying to navigate this on their own. How can we normalize these conversations and make a product that is over the counter, that is science backed, and that works? And so that is where Iris was born. I started looking for Canadian manufacturers. I wanted everything made in Canada. Uh, and so yeah, it was kind of an easy decision. Those were two products that I had a hard time finding. And then we just really like sat into the science. I had testers. We wanted to make sure that this product worked, but also was, science backed and something I was proud of.
Well, and I mean, the good majority of people listening are going to be females. And like, how much do we all invest into like our face skincare? Like, people are on, and I'm definitely always that one that's like, oh my God, I'm so overwhelmed. Just tell me what to get. Because I want something that like is good for, I'm not gonna get cancer from it, or that you know what I mean? There's like good quality products and doesn't
Mhm.
have all sorts of ingredients that are gonna be harmful. And, so there's so much out there, but we do the same thing with our face products and our skin washes. And as I get my daughter into this kind of stuff, like I think about all of that. And so why wouldn't we think about this in like our genital area too, right?
Yeah. And I couldn't, once we got into it, I was shocked to learn how many healthcare providers didn't know the difference, right?
Yeah.
How many of them were just recommending whatever samples came into their office. Meanwhile, they might have been doing more harm than good. And so it's been like my mission to educate the public, but also educate the providers because you know how it is in clinic. It is so hard to keep up with all of the newest research. And so I really try to do that for our community, especially all the healthcare providers we work with. I really am on the like pelvic pelvic health research, and I'm really keeping up, and so that we can help you guys stay up to date.
Yeah, so I mean, these conversations come up on a daily basis, like whether it be like, I'm talking about hormone with someone or a lubricant or a moisturizer. So let's just start with like, what are the differences? Because I think there's a lot of overlap,
Mhm.
but like, just help everybody. Let's picture that people have no idea. Let's just break down the difference between all of them.
Yeah, love it. Okay, so I would start by saying that people experience vaginal dryness, and there's many reasons. So it could be as part of menopause, like as the estrogen declines, you may experience vaginal changes. Let's just dryness is one of them. This also happens postpartum. It also is extended in parents who breastfeed. This happens because of some medications, as a side effect of some medications, like birth control or spironolactone. Anyways, so this happens. And so, depending on the cause, might be part of how we pick a treatment. But just to go through the three most common options. So, there's vaginal estrogen. Vaginal estrogen is kind of like our gold standard, it requires a prescription in Canada. it we give it as we're basically replacing the hormone, so it's often used in menopausal or postmenopausal patients, and we're actually giving the hormone back. When we give that hormone back, we improve the skin quality, we increase blood flow to the area, and so the person will create more of their own natural lubricant or lubrication. So that's the estrogen. And it is the gold standard, and it does more than just like the vaginal dryness. It helps reduce risk of UTIs that may happen in menopause. It also helps with any like physical changes that might happen vaginally or to the vulva. And we have a moisturizer. A moisturizer is more like, imagine like a moisturizer for our face, where you put it on, it binds to water and it hydrates the tissue right there. It is not a root cause. In some way, it's a root cause treatment because part of the menopause transition is that you make less hyaluronic acid. So in a way, it helps with that, but it's a little bit more of like just hydrating the tissue. That's what it does. So it's not going to reduce your risk for UTIs, and it's not going to change any structural changes that might happen because of menopause. But with a moisturizer, you can use it daily. Whereas with hormones, we have a maximum amount that we can use per week, just because we don't want to increase your hormones levels systemically. And then we have a lubricant, and a lubricant is used anytime there's increased friction. So that can be, pelvic floor physiotherapy, that could be tampon insertion, that might be sex. Anytime. I have some people that use a lubricant when they're inserting vaginal estrogen. Like if they're using a tablet, they might put some lubricant on the applicator, right? And so we have people who are on all three. Like I have patients that are on all three. They're using their vaginal estrogen 2 times a week. They're using their vaginal moisturizer 7 days a week, and then they're using the lubricant as needed. But the difference, and so there's a time and place for all. And sometimes you might need one of them. Sometimes you might need all three.
And I'm guessing like just like there's we have to figure out if we all have different skin types on the outside. Like it's going to be a little bit of a trial and error there as well, right? Because it's like, let's just start somewhere. And like I say, like I often tell my clients, like as far as the estrogen goes, for example, like they're going to start you with this, but then if it's not serving you well, don't just stop it. It's kind of like when you go get a sunscreen, like, oh, my friend recommended this, but if you get itchy from it, don't just stop using sunscreen altogether. Like figure out a different sunscreen. And same here, I'm sure, right? You're going to just start somewhere and then, okay, was that a good thing? Then great, stay on that regime. If not, let's fiddle instead of just stopping everything.
Yeah, totally.
I just think I actually had a client today that came in. She, in her 30s had to have, she unfortunately had like a cancer in and around her rectum. So she had some radiation and surgery and, obviously like a forced menopause quicker than her body was ready. And so she's recently started on some estrogen, some vaginal estrogen and some systemic estrogen. But just based on her symptoms, like, I wonder if you should try some moisturizer too. Like, I know that you're starting so many things right now, and I get that you just want the dust to settle because this is pretty new. But I'll just write that down as something when the dust settles to maybe add that as well, because like her symptoms suggest she could use more.
Yeah.
Yeah.
Another thing is like there's different ways we can apply all of these, right? And so the vaginal estrogen in my clinical experience, the most common prescribed is either a tablet or a suppository. And when we're using that, we don't really get any hydration to the outside tissue. And so sometimes it's a matter of like, it's so individual, right? Where we can say like, yes, you're going to use your vaginal estrogen tablet, but then you can use a moisturizer more on the outside tissue.
hmm I definitely notice, like, I'm just gonna share a personal symptom that I'm noticing that's showing up in my mid 40s is like just this sense that I need to pull my underwear away from my body more. Like, that's new. Does that make sense? And I find that's something like because or someone people say like when I sit on my bike seat now it's like just a different irritation, and so that's those symptoms obviously like pain with intercourse or just like oh like kind of like frictions like the way my genitalia is down there, because obviously everyone has different genitalia, and sometimes people say I just think I feel rubbing now, and so there's all sorts of different symptoms. The thing is, we don't talk about this. Like, you don't usually go to coffee with your friends or out for a glass of wine and say, like, how's it feel down there? Right. And so
Mhm.
it's amazing how when you bring this stuff up in the clinic, people are like, oh my God, yes, I have that. Oh, I didn't know it could be better, but it's so different. Like, if your skin is dry, you don't hesitate to do something about it. Like, you don't think, oh, I guess my skin's going to be dry forever. Right.
And I find that like it's a little bit easier for people to put it together when it's like painful intercourse, let's say, where they're noticing, oh, yeah, now I have pain. I never had pain before. But then when it's things like riding a bike or wearing certain clothes, and they don't really put that together, they just notice that, yeah, wearing jeans with like a seam in the center is more irritating. And so sometimes people don't actually put together that there are some vaginal, vulvovaginal changes happening because they're altering their lifestyle around it.
So okay, so let's say, I know it's going to depend, but let's say, how do you know then? Like let's say someone's listening to this and they're like, okay, yeah, I have some of these symptoms. Are you suggesting then that, best case scenario, they start with estrogen? Like when, I guess, what are the things when someone comes to you, are you going to talk through with them of what you're going to start with? Because I understand they can all be used, but I definitely I think of myself and think like I don't not like to add too many things at once. Otherwise,
Mhm.
I like to know what's doing what. What would give me some examples of when you might start with an estrogen and maybe when you might start with a moisturizer.
It's a good question. So it definitely, like you said, it depends on the person. So some of the big ones is if it's a cancer survivor. So if it's any type of gynecological cancer survivor, we do need approval from the oncologist. That's the Canadian guidelines if we are adding any estrogens. So if it's very severe, that I think because it's basically severity, right? So we give vaginal estrogen if it's we call it very severe. For mild to moderate, we're looking more at a hyaluronic acid based vaginal moisturizer. And so let's say I think it's very severe, but the person's a breast cancer survivor, then I can't give them an estrogen prescription. And so I would say I will write a letter to your oncologist that I think this might be our best course of action. But in the meantime, I'd probably start on a vaginal moisturizer, even just to get them some temporary relief, because we're probably going to continue to use that moisturizer even if they get the estrogen prescription. So those are like the like definitely cancer survivors. We're starting with hyaluronic acid. If it's mild, if the person is kind of like, yeah, it's a little irritated, or if the irritation comes and goes, if the person's still cycling and they notice that in the PMS window it's a little bit worse, I might use a moisturizer just because we know it's only like happening for a week. Same thing with anybody who's postpartum. We know it's like more of a temporary time, so I probably use a hyaluronic acid. And then there's people who don't want to use hormones, right? And
Hmm.
even though, like, I'm a clinician and I am prescribing vaginal estrogen all the time, it doesn't matter how much I go through the safety, they are not comfortable
Hmm.
using a hormone. And so that's somebody who, for sure, we're doing a moisturizer.
Yeah, and you might
If
just go. I didn't mean to interrupt. Go ahead.
that's okay. No, I was just going to say, and if the person is more severe, if maybe they've tried a moisturizer, or if they're suffering from something like chronic UTIs, I'd probably start with an estrogen.
Hmm. I think about some of the people. What I was gonna say when I rudely interrupted you was basically like I can also think I'm sure there's times though, even though maybe I guess their symptoms are what you call severe, but they're still like no, then sure, like let's try the moisturizer, like you know what I mean? Because I think that's what at the end of the day we want to give them autonomy anyway. But I'm sure that it just helps them kind of like okay, I've tried that and yeah.
Mhm.
I think of some of the patients that come in and maybe describe their description makes me think like, wow, I'm going to see signs of low estrogen. Just, and when I say signs of low estrogen, I would be noticing that like when I part their genitalia, ouch, they're saying ouch, or the area looks a little bit more closed, let's say, more
Mhm.
pale in color. The tissues look frail, sometimes a little bit fused. Anyways, that would be kind of visual signs of low estrogen, but they're describing what I think I'm going to find that like, oh, it's itchy or it's sore. I can't have sex. Something won't fit in there. It hurts to have tampons, anything like that. And then when I look, I'm like surprised. I'm like, huh, actually doesn't really match at all what maybe I thought I was. Would you say those are the people that, um, again, like as physios, I'm thinking of all the physios listening to this. We don't prescribe hormones. Would those be people that sometimes we should be? I'll send a note to your doctor and ask them to look and have a conversation with you about estrogen, or maybe best to be like, let's just start this. And then down the road, we know if we need to bring up this with your doctor. Like thoughts on that for the
Yeah.
physios listening?
Yeah, no, it's a good question. I would probably sometimes treatment helps us answer questions, right? And so
Hmm.
sometimes giving somebody a treatment. So if we gave a hyaluronic acid and things were starting to get better, but not fully resolve, that would be a really good time to maybe reach out to the doctor, write a letter. Um, and then other times I've had people use moisturizers and we saw zero improvement. And then I'm thinking more,
Hmm.
maybe this isn't so much a hormonal thing, right? We also got to take the whole patient looking at like, well, how old are they? Are they still cycling? Is this coming and going? What are they describing? Is it pain? Is it itch? Is it burning? Is it radiating? Right? And so I think that that is a good patient. I would probably try it on. Um, and then depending on how it worked and how they felt would help me decide what I wanted to do next.
Let's go back to the lubricant for a second. So this lubricant that Iris formulates, this is a water-based lubricant.
Yep.
Can you just talk a little bit about the differences between different kinds of lubricants?
Yeah. So the big ones are water-based, there is oil, and then there's silicone. And so pros and cons to all. People ask me what's the best. The best is whatever works for you and whatever you like. There is no best. And so there's best within a category. Like there's, what we're looking for in a water-based, but it's really personal preference. So some of the pros of them is that silicone lasts really long. If you're somebody who doesn't want to apply multiple times, or if you want to use underwater because it works underwater, then silicone might be the one for you. The downside to silicone is that silicone is not compatible with silicone products or silicone tools, let's say tools and toys. Also, silicone needs to be washed off because it won't just absorb in the body like something like water based will. It's a little bit more messy, might stain your sheets. And then oil-based, while super convenient because you might be able to just go to the kitchen and grab some, uh, a little bit not usually pH matched, like the pH of coconut oil is closer to 8, and messy in the sense that it might just stain your sheets, but easy to use. Again, doesn't really need to reapply. Not always compatible with latex condoms.
What do you mean
And
not
then
always? Like, how would they know?
yeah, that's a good question. I have really been looking in the research because most of the time they've always said no to oil with condoms, but there's some newer brands on the market that are saying that they are compatible
Mm,
with latex condoms. So I haven't been able to find any data on why some would and some wouldn't. I don't know if it's something about the latex, like if they're putting some new technology in it to make it compatible, but there is just worry that the oil is going to like wear degrade the latex and then it might just not be as effective as it can be.
mm,
And then the third category is water based, and that's where we live. We chose to do water based because I find that in my patient population, it's the most natural feeling. And that's what a lot of my patients were looking for. It's also the easiest to use for people who are doing like dilator therapy or using any type of toys or anything like that. And so water based was an easy decision for me. And then it was like really honing in on like what are all the details you need to know about a water based lubricant.
I find this comes up a lot for the pessary people. So I often say, like, especially as people are starting to put in their pessaries, I've been recommending the lubricant, but sometimes, and I even sent you a question asking you, like, which one should I recommend? Because sometimes I think like people are always forgetting. That's the number one thing I feel like I hear is I forgot, I forgot. So I'm like, I wonder if I should get them to use like kind of kill two birds with one stone and use what if they put the moisturizer on their pessary? Like, what are your thoughts on that?
Yeah, no, it's a good question. And you're right, compliance is hard.
Yeah.
And I have some tips on compliance for you. But I would probably say for the pessary, I would use a lubricant just because
Mm-hmm.
the lubricant is made more to sit on the skin and not really get as absorbed. Whereas
Mm-hmm.
the moisturizer, like imagine our face, like when it's super dry, we put it on and it just gets
Yeah,
absorbed.
right.
So we want to probably use the lubricant more just so it can sit outside and just help with a glide. But when I think about, and obviously this is generalizing, but most people that I know using a pessary are closer to that like GSM
Mm-hmm, mm-hmm,
age.
mm-hmm,
And so there probably is some dryness there too.
mm-hmm,
So I probably would say like use your moisturizer daily, at least for a couple days before, or try to really keep it in your routine and keeping that regular. And then when you actually insert the pessary, um, use the lubricant.
mm-hmm. Do you normally, like a lot of people use their estrogen at night before bed so that it's not wiping off? Same thing for moisturizer. Would you say that's generally any times where you wouldn't say that you
Yeah,
would suggest more in the
so
morning?
yeah, so I used to always recommend it right before bed, but then so in order to hit so our active ingredient in our moisturizer is hyaluronic acid, and so in order to hit that therapeutic amount of hyaluronic acid, you have to use 1 ml of our product. And 1 ml was just too big. And so I actually like working with people found that applying less twice a day was more comfortable. They didn't feel like it was like seeping out when they were
Mm-hmm.
laying down. And so now I'm actually recommending two pea-sized amounts twice a day. And my compliance hack I've been doing with people is to actually put it beside your toothbrush because you brush your teeth twice a day.
Mm-hmm.
It is a pretty bottle. We made it like that for a reason to sit on your counter so that you don't forget and let the teeth brushing be your reminder to also moisturize.
I find that to remember some of this stuff for myself, like I have this like face regime, and so I make sure like everything starts on the counter, and as I use them, I put them in the basket so that I'm okay. Because otherwise, I'm like I get pulled away by the kids like after half. Okay, did I do that? Like I do that all the time, so I feel like that's
I
almost
know.
my plan is like start it on the counter, and then when it's done, put it in the basket.
Yeah, because there's
So
just so many things, supplements, routine. Like there's so many parts of our
yes,
routine that we got to kind of like we got to tackle it onto something we're already doing.
yes. Okay, let's talk a little bit about kind of like I was saying, is it's really overwhelming to make a pick because and this is what I used to say to people, use a moisturizer. And then I kind of left it at that. I think sometimes at the beginning, just because I didn't really know what to tell them. But as I learn more, I've learned like, wow, like no two alike, just like it's different to use the cheap hotel conditioner versus like the more expensive conditioner. So can we talk a
Mhm.
little bit about like how like because at the end of the day certain some of the things matter to people like for example packaging, like I don't want to throw as much away. I care what it looks like. I care about the cost. I care about the ingredients. So we can talk ingredients. So can we talk a little bit about like what should people consider when they are purchasing um like a moisturizer? Let's start with a
Hmm.
moisturizer.
Hmm. So with the moisturizer, you're going to first look at what is the active ingredient inside of this product. And so there is probably two big researched ones. One of them is a chemical name that I don't even know off the top of my head. And the second is hyaluronic acid. And so the hyaluronic acid is it's a little bit more natural, right? Your body makes hyaluronic acid. Your body is familiar with what hyaluronic acid does. And so ideally, we're starting with one that has hyaluronic acid base, especially if you want to keep it a little bit more clean. There is research on vitamin E as well, like used vaginally, which we have vitamin E in our product. It's just not our active ingredient. And so look at what is the active ingredient. And then the rest is really just filler ingredients, right? So, like, what is making up this product? And so, of course, we always want to look at allergens. I was surprised to learn how many people have allergies to ingredients like lanolin or aloe. And so, you're looking at that stuff. And then, you know, there is a, I don't want to villainize glycerin. Okay. I don't, it's a researched product. It's a Health Canada approved ingredient. But the one but I will say is working in pelvic health and being with people who just tend to be more sensitive. They tend to be more sensitive to glycerin. And so it's not that you need to absolutely pick a product that doesn't have glycerin. It's just if you know you're somebody who is a little bit more sensitive to ingredients, glycerin might be one of the ones you are sensitive to, and it has a little bit of a sugar backbone. So if you tend to infections, if you tend to BV, if you tend to, candida or yeast infections, then you might not want to use something that has glycerin in it. So that's just kind of like my flag I put up that I by no means want to vilify it, but also something you might want to keep an eye on. And that's kind of it for the hyaluronic acid. The other thing, I mean, for the moisturizer, for the other thing I like to look at, and this is probably my like clinician brain, is the mode of application for the reason I was talking about before. When people experience vaginal pain due to dryness, the pain happens in the lower one third of the vagina and on entry. That's where the pain is. And so when we're using things like an applicator or a suppository, you might simply be putting the product too far up that's why you're not feeling the benefit. And so we were super intentional. Like, I did not want an applicator. We thought about maybe putting one on the side that people could reuse and wash, but I just decided I like part of our stigma smashing is also making it okay to know your own anatomy, look at your own anatomy, and touch your own anatomy. And so with the finger application, for me, that just worked the best in clinic because even when I was recommending vaginal moisturizers or vaginal estrogen cream, I always said use your finger, not the applicator. So that's another thing to look at and like the difference that you might find when you're looking at all of your options for
Well,
the moisturizer.
I think that's a question that a lot of people have, like with like the suppository moisturizers is like their question is often like, how far exactly does it seep? Do you know what I mean? Like, because they often come in saying that like, yeah, I feel better, but it still hurts here, right? So what do I need? Do I need more? Do I need something different? But so then when would you say that more of the suppository is indicated?
It's really like I would recommend a suppository more in somebody who doesn't want to use just like their finger.
Touch,
And like
touch your
there's some
finger. Yeah,
people,
less messy.
and there's some people for religious reasons they might
Yeah.
be wanting to use an applicator. So that's when I would say use an applicator or the suppository in that case.
What about like, so can you talk a little bit? So you've talked, okay, can you touch on like, because there's a lot of talk around like the pH, right? So people
Hmm.
always want to know, like you've talked about ingredients, but can you talk about like the pH, right?
Yeah.
People always want to
Yeah.
know like, what does that mean?
Yeah, no, that's good. I totally missed that.
That's okay.
The pH, so basically the healthy pH of a healthy vagina is around 4.5. It's like between 3.8 and 4.5. And so that acidic environment is there really to protect you from infection, bacteria. It's just we want to keep you in that acidic environment. When people transition through menopause, part of the estrogen decline is that it changes the vaginal microbiome quite a bit. And one of the things that happen as a result of that is that the pH tends to go up. And so, like, I typically will swab people around like a 7 or 8 pH. And that higher pH just makes it a better breeding ground for infection. So, we do see more UTIs, we see more yeast infections in that time of life. And so, when we're using a product, whether it's because you're in menopause and you're already kind of trending a little bit high, we don't want to use anything vaginally that's going to move you even more alkaline, right? We want to really try to maintain a healthy vaginal pH. And that's whether you're in menopause or you're healthy. We just want to keep it, we want to keep the area healthy, especially in like a moisturizer that you're applying every day.
Would someone that's trying to choose a product see that listed on the box?
Usually not.
Okay.
And when I was doing like my research on products, I reached out to a bunch of moisturizers and lubricants. This was before I was making my own, and I was just trying to find a good product for my patient. A lot of them didn't answer,
Oh,
or a lot of
interesting.
them said, like, we will get back to you and never followed up. Some of them did, and some of them had it, but I don't typically see a lot of them writing it on the packaging or on their like websites or anything.
Did you find that a lot of them were too alkaline?
Yes,
Yes.
yes,
What is that then? Is it what they're putting in it? Like what, and is
yes,
it cheaper
exactly.
to put other, do you know what I mean? Like why not, if it's science, like why not just follow the science? Like so what do you
Yeah,
think, like what could they do to, like why would they be doing that?
yeah. No, it's a good question because so basically, when I was formulating, maybe this story will give a bit of a explanation, but I was formulating and we were emailing back and forth, and the chemist called me and he goes, "So you basically just want water?" And I was like, "What do you mean?" And he was like, "Well, how, it's going to be challenging to make a product with all these parameters that actually works, right?" And so all of that to basically to answer your question is like to hit all of these parameters and use a product that works. I mean, and have a product that really works isn't easy. And so you end up having to pick more expensive ingredients to make your product so that it does work, right?
Mhm.
And so, or you compromise and you use the cheaper ingredients, but then you compromise things like osmolality and pH, right? Or putting those irritating ingredients. And so he basically told me like something's got to give. We decided to pick the more expensive ingredients and, maintain like optimal numbers for everything. But yeah, maybe a cost thing. Also, like a lot of people don't know this, right? So let's say you're going to buy a lubricant. People are looking for one that they don't have to apply too many times and it's just going to work, right? And that they feel good and it works. They're not wondering like what's the pH. Well, not everybody, anyways, is wondering like what's the pH of this and is this doing more harm than good? And so that consumer might be okay with or may not notice a pH of like 6 or 7. Another thing I'll say is like it really depends on who's buying it. So when I think of like somebody who is maybe in their 20s and like the vaginal microbiome is ideal, maybe they can use something with a high pH once or twice and everything's going to be okay.
Mhm.
But in somebody who's in menopause already at a higher pH, then we go put a high pH product on them, they might get irritated or they might end up with an infection.
And obviously the same goes for the lubricants. Like I brought up moisturizers, but like all this same lingo and all these same parameters exist for lubricants.
Mm-hmm.
Um, yeah, and I
One of the
think
ones I would add though for the lubricant is like that a lot of talk about osmolality,
yes.
right?
Yeah, I was going to ask that. I want to quickly, I was trying to decide what question I wanted to ask you first, but I was going to say, I think about the people on that note of like you go and buy something and you might not tolerate it. I can't tell you how many people, because I always say healthcare is trial and error. Like everything I give you is just a suggestion and let's try it and see what happens. But if I suggest like vaginal moisture, I've tried that, been there, done that, and that was terrible. But then I find that then I will love to have this episode to be able to share it because I'm like, wait a minute, it's literally like my example of sunscreen. If you get a rash from it, you don't stop using it. You try to go to something else. And I think this is what happens is we think that they're all the same or like tampons, they all fit different. You know what I mean? Like,
Yeah.
but I think this is just such an area that we're just so generally as women undereducated.
Yeah, I love your sunscreen example because that's exactly it.
Yeah. Okay, so then exactly, that's what I wanted to ask you about. I wanted to talk a little bit about osmolality too, because that's an important thing to like, people don't understand what these words mean and why
Hmm.
they matter.
hmm Osmolality, and I just lost my train of thought. Osmolality is basically, because we'll just kind of go into the science of it, but osmolality is the movement of water. And it's something that we need to consider only really in a water-based lubricant. There is no osmolality of something like in something like coconut oil or in a silicone-based lube because there is no water in those products. So osmolality is the movement of water. And so I like to describe it as, so if you put a product on your skin, the skin has a certain osmolality and so does your skin. The product has an osmolality and your skin has an osmolality. And so if the product has a higher osmolality than your skin, what will happen is your body will start releasing water to try to create homeostasis between your body and the product, right? And so water will move out into the product to try to create this homeostasis. And so, in a product that has a high osmolality, if you're using it vaginally, the same thing happens. Water starts to move outside of your body into the product. And so, while it might feel fine while you're applying it, whether it's the moisturizer or lubricant, what it will do in the long run is it will dry out the tissue more and it will also cause cell death. And so, what I was just absolutely mind blown to learn when we were formulating was that nobody cared what our osmolality was. I was the one having to say, hey, can we get third party testing on this? Because I need to know before we do anything what the osmolality is. There was no rules or guidelines or recommendations on what these numbers like needed to be. And so we basically we they basically the World Health Organization has recommendations that they have, and the recommendations are to stay below 1200 millimoles per osmol or milliosmoles per kilogram. But most of them on the market are in the 6000s. And so we're just going to be seeing a lot of cell death and a lot of drying out um, in products that are that high. So they're just too different from the body. And this is why we say that the water-based lubricants are the most potential to be irritating because we need to consider things like osmolality and pH.
Again, so you're saying like not often would someone ever find the pH on a bottle? Would they find the osmolality?
Even more rare.
How it's like how is someone supposed to know? Like,
I
you know?
know. There was a cool research paper that came out and it took like all of the most popular North American products on the market and it compared them and just like outed all of them on like what is their osmolality and pH. And I was honestly blown. I was so shocked to see some of the names everybody knows and just like they were like out of the range for how
Can
high they were.
am I allowed to share that? Like that's a paper that came out?
Yeah, I'll send it to you.
Okay.
It's a little old now,
Yeah.
but yeah, like it was just like, wow, do we not know about this? Or, are we picking those crappier quality ingredients to make a like cost effective it like I don't know, maybe it's their marketing, maybe it's like if you use this you're going to get more dry and then you're going to need more lube. I don't know.
Yeah, it's yes, crazy. Can you talk a little bit about cost too? Because I think at the end of the day, people care about cost. So can you talk to me about considerations for the cost of your product and like how it compares to others?
Yeah, so like with our products, I think that upfront they look a little bit more expensive, especially if you're looking at the vaginal moisturizer. But we are more than double most of like size wise, most of the products on the market. And so most of the drugstore options, you're looking at 10 to 14 days of application for $20 to $25. Ours is $42 Canadian, but that will give you 30 days worth of product if it's used correctly. And so I have not seen a product that's cheaper per application than us. And the lubricant is also a little bit more expensive than maybe drugstore. But when you're looking again at like the quality and the ingredients and stuff, if you're looking at something or brands that are more comparable as far as quality, we're pretty well the same.
Awesome. And one other question I had about that is okay, so then obviously like you ship anywhere in Canada. Do you only ship in Canada?
Well, we were shipping to the States until last
Yeah, yeah,
week,
yeah.
when some tariff things happened.
Yes.
So, or all of North America,
Yeah.
we were shipping to. So, but Canada for sure.
Yes. And so I think that obviously like anything you're ordering online, like sometimes it's like, oh God, I have to pay shipping. But it sounds like once you figure out if you like it, then obviously you order enough that, helps you with that, spreads out that shipping. Because when does it expire? That's another question like people will have is like, how long can I have it before it expires?
Yeah, no, it's a good question. So on the bottles, there'll be an expiry, but I find the product really works best if once it's opened, it's finished in a year.
Okay.
So depending on which lot you have is going to be the actual expiry date. Um, and yeah, no, that's a good question.
Okay. Okay, so can you like I hate to say the term dumb down, but like can you talk a little bit more about like say specifically how you tell people to apply it? So
Yeah.
yes, put it on their finger. They're putting a pea size. You recommend it ideally twice a day.
Mhm.
If you have to do two peas at once because you're having a hard time remembering to do twice, but like where do you tell people to put it? How far up? How far around?
Yeah. So I will, it's two pea-sized amounts twice a day.
Okay, sorry, I
So
misunderstood that.
like PP
Yeah,
twice a day. And then I usually say insert vaginally and about an inch is
yeah.
good. Put it vaginally and then kind of like pull out and then whatever's left on your finger, apply externally.
Hmm.
The research on hyaluronic acid, this is for the moisturizer, but the research on hyaluronic acid basically said you can use it every day for 2 weeks as what we call a loading dose to really like saturate the tissue. And then after that, you should be able to use it 3 to 4 times a week. But we also have research on people using it daily. So you could also just continue to use it daily, but convenience and stuff, it's okay if you're getting it 3, 4 times a week. And then, yeah, I say insert and then pull out and just use externally as well. If you need a little bit more than two pea sized amount, that's okay too. We just want to make sure we're hitting at least the therapeutic dose to see the changes.
And just for clarity, you also want them getting it up and around their urethra too. Yes.
Yes,
Okay, because
yes.
some
And I say
people,
front to
yeah,
back.
yeah, the whole hole that
Yeah.
includes the P tube as well.
Yeah. And
Yeah,
some people put it around the anus too, because some people experience dryness and itching there as well.
yeah. Okay. Any side effects that you've heard of that or things that you want people to be aware of, kind of in my example of sunscreen, if it bothers you or it's itchy, that would be a sign that you need to make a change.
Yeah.
Anything that they should look for that would suggest it's not the one for them.
So, in some people, when the tissue is really, really dry and you use anything, whether it be hyaluronic, any type of moisturizer, it can cause a little bit of tingling when you first use it. I kind of imagine it like a sunburn. Like, when you get a sunburn and you put some aloe in the
Mm,
first couple of days, it kind of like tingle. It doesn't hurt, but it like
mm-hmm.
tingles. That is just because of all the damage done to the skin and it's just rehydrating. So it is normal that in the first couple of applications that you might experience some tingling if the tissue is really dry. So that doesn't mean that you're having a reaction to the product. That's really common in dry tissue. We always say if there's any irritation, one thing I'm so proud of, I have to say, is I'm proud of how many amazing reviews we have, but that is like that was kind of expected. We looked at the research and we made a product that followed the research. What I'm really proud of is how we don't have any bad reviews. We don't have people kind of calling and saying this burned, I want my money back. This is like uncomfortable. Maybe we're too new and we're just starting out, but like we were really cautious with the ingredients we used to try to make it so that we didn't have side effects. And so, like anything is possible. People have allergies. Some people have unknown allergies. And so, if anything is hurting or burning or doesn't feel good, talk to your doctor and stop using it. But that's not something we're commonly seeing.
Awesome. Well, I thank you on behalf of women that you took the time to do this because um I know these ventures aren't just like I did this yesterday. Like this has been a lot of blood, sweat, and tears. And I'm sure there's been times you wanted to give up. And so yeah, I really hope that I can help you spread the word.
Thank you. And yeah, thank you for sharing your platform to talk about it and really like my at my core, my mission is to smash stigmas and educate because there's so many people that are suffering alone and podcast is my favorite place to talk because it's a nice place where people will put their headphones in and maybe go
Mhm.
for a walk and listen to the conversation that they want to have. They're just not ready to have yet.
Mhm. Is there anything I didn't ask you, Dolores, that you feel like you want to be shared?
I don't know if you want to share your discount code, but
Yes, absolutely. I'll make sure that I put that in the show notes as well. But it is, I'll make sure there's a link in there, and the
Mhm.
discount is Pelvic Floor Project. Yeah, no, I appreciate that. I appreciate you. I appreciate all you're doing and your time today.